Hello,
Hi.
I'm going to be your student nurse today. My name is Jabari Harrison. Can I have your name and date of birth, please?
Sierra Hoskins, 5893.
All right, I'm going to check your wristband just to make sure that's all right. All right, today I'm going to be doing a physical assessment head to toe.
Okay.
So starting off, do you know where you're at?
I'm at MGA Hospital.
Okay, and Trump, do you know the president?
Trump.
And do you know what you're here for?
I am here to purchase for a physical checkup.
Okay, so I assessed that, she's oriented, she's aware where she's at, okay? I'm gonna just make sure everything's all right. She's dressed appropriately, groomed well. I wanna check her nails right
My
quick.
nails have fungus on them, so.
Nails,
So,
nails are fine. I'm just gonna do your capillary refill. All right, they come back less than 3 seconds, they're normal. All right, I'm gonna inspect your hair. Hair is all right. I don't see anything groomed, good for ethnicity and whatnot. Okay, let's see. Are you having any are you having head, are you having any head injuries?
no.
No?
No.
Okay. All right. So now I'm going to assess your head. So first I'm gonna see that it's symmetrical. I don't see anything wrong. I don't see any wounds, nothing. It's perfect. I'm gonna see your eyes right quick. So right there. All right, seem normal to me. Can you just follow my pen light right quick? All right. Okay. And I see that your pupil size is approximately a 6, so 6 millimeters. So that's normal. I see that. All right. Next, what I'm gonna do is assess your respiratory rate. So, for starters, first off, for your respiratory rate, are you having any coughing? No coughing?
Nope.
Okay. Can you turn to your right
Okay.
and and cough for me real quick? All right. So what I did was just that will clear up any cough sputum or any mucus that's in your body. So now I'm gonna assess your respiratory rate. So right now, I'm at her right upper lobe, her left upper lobe, her right lower lobe, and her left lower lobe. All right, can you lift your left arm up right quick?
Left arm? Okay.
All right, left lower lobe. All right, can you lift your right upper lobe? All right, I'm at her right upper lobe, lower lobe. All right, can you turn this way so I can put your, all right. I'm at her left upper lobe. I'm at her right upper lobe. I'm at her left upper lobe. I'm at her right lower lobe. And then her left lower lobe. Right now I'm gonna assess your respiratory rate, so just breathe normally. I will assess this for 30 seconds. All right. The respiratory rate is at 12, so that's normal. Okay. Now do you have any questions about your respiratory?
No, no issues.
Okay. All right. Now I'm gonna assess your skin elasticity right quick. I see it's normal, hydrated and whatnot. Okay. Now I'm gonna assess your cardiac section. So for starters, I'm gonna assess your JVD, your jugular. I see there's no disformities. All right. And now so what I would do, I'm gonna assess your aortic pulse right quick. I'm gonna do on the left side. I see it's a +2 regular, and just to inform you on the pulse section, we have your aortic up here. We have, you have your aortic up here. You have your auxiliary pulse right here. Right here you have your brachial, and if you do like this, you have your radial pulse. And on your thighs, you have your femoral, and at the back of your legs, you have popliteal. And right here, you have at the back, you have your pulse. Yep. And then you have right here your dorsalis pedis, right here. All right. Now I'm going to assess your gastrointestinal system. So, do you have any bowel movements or anything?
Yeah, I have one.
Okay. Do you know when the last time you had your bowel movement?
Last night.
Last night. Okay. And do you have any stomach pain?
No.
Okay. All right. So now I'm gonna assess your abdomen. So for starters, I have the first quadrant, second quadrant, your third quadrant, and your fourth quadrant. All right. I see there's no like swishing, no whooshing in your abdomen. And if I did, I would use the bell of my stethoscope to observe it, and I would do that for 5 minutes. And I'm just going to observe your apical pulse just to show you where it is. But I will do the 5 pulse section. So for starters, I'm at her aortic pulse, then I'm at her pulmonic, then I'm at her third, which is her Erb's point, then I'm at her fourth, which is her tricuspid, and then now I'm at her fifth, which is her mitral. And this is where I will listen to her apical pulse for 30 seconds, but for the sake of time, I want to do that. All right. Do you have any urine problems?
No.
No? Okay. All right. Let's see. All right. I'm just gonna have you. For starters, I'm gonna tell you to breathe in and breathe out on this consensus barometer. You would do this almost like every commercial break, and this is for like people would use this for post-surgery just to make sure we're breathing. Okay, so can you breathe in? Breathe out. Perfect. Thank you. All right. So I seen one reviewing her eyes. I see that her glaucoma scale was all right. She's oriented. She's a +15, and I see that her glaucoma scale is all right. Her Braden scale's good. I see that that Braden scale's all right. And to measure, you would use sensory, mobility, and okay. I'm gonna ask you a few questions. So for starters, do you have any chest pain? No chest pain. Okay. Do you have any trouble breathing?
No.
Okay. Let's see. Do you have any trouble seeing?
No.
All right. And do you know how you got here?
Yes.
Okay. So she's oriented ×4. I see that she's aware of her space and she knows she's aware. And let's see. Okay. So now I'm gonna assess your musculoskeletal. So for starters, can you flex your elbow? Alright. And then can you do this? Alright, can you flex it again? Alright, I see that she's resistance. She has resistance. Can you do it on your right? So flex it like this. Can you do it like this again? Alright. And then can you flex it again? Alright. I see she has resistance. And for your leg, can you flex it like this? Alright. Can you do it like this? Perfect. And then for your left, and then for your right, can you do it again? Can you flex like this? Can you flex? And then can you do like, can you flex towards me again? Alright. She has resistance. And I'm going to do it on your left again. Alright, she has resistance. And for your feet, I'm just going to ask you for just do this again. And then can you flex like this? Alright. Perfect. And then for your right, you can go like this, flex. Perfect. All right, thank you. And can you stand up for me real quick? All right, so now I'm gonna set your gait and balance. So for starters, I'm gonna stand right here. And can you face towards me? And can you walk heel to toe? Perfect. All right, can you walk back normally? Perfect. So I'm going to need you to close your eyes. Alright. I'm going to hold you like this. I'm going to assess your balance for about 30 seconds. All right, thank you. I see that your gait and balance is perfect. Do you have any trouble walking?
No.
Okay, you can sit. All right. Okay. I'm gonna take the time to look at my paper. All right. Who's talking about? How much time you want to go?
7 minutes.
Okay. Inspection, patient stress, weapons focus, patient vision. Okay. Here, Scott. Scott, what I did. Head, symmetry, external, focus. Pupil size, no, open nose, mouth. Swallow and speech. Neurological. Okay, I did neurological. Respiratory rate. I did. Okay, I took breathing pattern. Patient term, cough at the bed. Cardiac activity. Dorsalis. Okay, so I'm just going to go back in. Capillary refill. Upper extremities for edema. Okay. Question. Aspect of abdominal. 4 quadrants. Palpated lightly. Range of motion. Okay, so range of motion will go down. Need to palpate. Palpate lightly. Cardiac, I did. Capillary refill. Inspect. Edema. Okay. So what I need to do, go over hands of them. I need to do nose, eyes. Okay. Color, whiteness. So this is it. Neurological, I got down. I did neurological spirit. Respiratory, I did. I was doing breathing pattern. Capillary refill. Edema. Palpate. So good. Palpate. Edema. Respiratory. Swelling. So start with 4 minutes, thank you. All right. Nose. Nose. Over the head again. Head. Head. Ears. Eyes. Nose. Mouth. Just gonna spread. Okay. Respiratory. Gastro. I got that. Let me do gastro first. Palpate. Respiratory. Palpate for edema. So palpate. Then cardiac. Edema. And then, okay. Alright. Palpate, edema. Okay. Palpate, edema, head. Okay. Palpate, edema, head. Alright, I'm back. So I'm gonna reevaluate some stuff. So for starters, I'm going to palpate your abdomen to make sure it's soft. Alright. I'm palpating her lower quadrant. Her second upper quadrant. Upper quadrant. Fourth upper quadrant. Alright, do you have any pain in your stomach?
No.
Okay. And did it hurt when I was touching?
No.
Alright, cool. So, okay, that's the gastrointestinal. Going back to the cardiac, I'm gonna assess for edema. So I'm just gonna. Alright. Alright, I see there's no specific edema. Going back to her general inspection, I see her color, her skin color, pigmentation is all good. I see is right for her ethnicity. I don't see anything. Her temperature is warm, regular. And I'm gonna assess your, do you have any trouble swallowing?
No.
Okay, can you open your mouth for me? All right. I see that. See her. There's no sorts of any going on in her mouth. Okay, and then I'm going to inspect your ears. So can you move your hair like that? All right. I don't see any drainage in the ears. All right. Now I'm going to inspect your nose. Can you do this for your nose real quick? All right. Now do it like this. All right. I heard that she's breathing perfectly in both faces of her nose. I'm just gonna inspect the nose right quick. I see it's dry. There's no source of drainage, and let's see. Do you have any questions for me?
No.
All right. Now I'm gonna go document this stuff, and I'm gonna document the stuff, bring it to my doctor, and he's gonna come back with you. Okay.
Okay.